Just a few hours ago, the state vaccine mandate for healthcare workers went into effect. This is what it looked like outside ECMC this morning as people got there for work and to go there for procedures. As you can see, everything business as usual. The few employees we talked to said things were pretty normal. All hospital employees had until today to get their first dose of a COVID vaccine, and they have to be fully vaccinated by next month. Now, there is a concern about the mandate causing staffing issues at hospitals that are already spread pretty thin. So here's where hospitals stand right now. At ECMC, officials anticipate as many as 400 employees, 10% of their total staff, will not meet the mandate. Starting this morning, the hospital's pausing all inpatient elective surgeries and limiting ICU transfers until further notice. Last week, the hospital said emergency room wait times were up to 8 hours in some cases. As for Catholic Health in Buffalo, their vaccination rate is at 90%. They are limiting some elective surgeries starting today. As of last night, Kaleida said their vaccination rate is 94% and about 97% for patient-facing staff. However, according to state data down in the southern tier, Olean General Hospital, which is run by Kaleida, is only 75% vaccinated. And at Niagara Falls Memorial Medical Center, President Joe Ruffalo says they are fortunate to have a 93% vaccination rate, but he's concerned about a chain reaction of problems.
We may see more long-term care patients occupying hospital beds because they can't be placed in a nursing home, which then would have a ripple effect on the emergency room because you'll have medical admissions in your emergency room that can't make it to the floors because those beds are occupied by long-term care residents.
Now, the next big question is how the state is going to help when it comes to hospitals being short-staffed. Governor Hochul has announced her plan to help. She announced over the weekend that 84% of hospital staffers across the whole state are vaccinated. So to cover any shortage, the governor would declare a state of emergency. Also, the state would use medically trained National Guard troops or request that federal medical disaster teams come in to help. The governor also mentioned recruiting retirees to come back into the medical field, something that's easier said than done, or getting recent grads from nursing schools accredited more quickly. A large group of healthcare workers gathered in Niagara Square over the weekend protesting the state's vaccine mandate for medical professionals. The group carried signs calling for medical freedom, religious exemptions, and their right to choose whether or not to get the vaccine.
I would like it to be freedom of choice, where people are not getting pushed up against a wall saying, if you don't get the shot, you can't work. If you don't get the shot, you can't go to a restaurant. America was based on freedom. It is still based on freedom, and we should be able to have the freedom of choice.
Present at the protest was Erie County Comptroller Stefan Mahailu and mayoral write-in candidate for Buffalo, Ben Carlisle.